and welcome to another episode of Scanning the Market. Today, I sat down with Jason Park, the CEO of AIRS Medical. After receiving a significant round of investment, they are on the verge of global expansion. I hope you enjoy this episode. Well, yeah, thanks for joining me. I think MRI is one of the most important tools in imaging, and it also has the biggest bottlenecks. I think what you do at AIRS is very, very interesting because you sit right in the middle of that. Using AI to get more from what the hospital already has, and in a time where MRIs cost a couple $1 million, there's a shortage of radiologists, and there's thousands and thousands of patients who are waiting for scans. It's no wonder that you've seen the sort of growth you have, right? You guys have been on a real rocket ship, I'd say. We've seen that firsthand. So before I guess we get into AIRS, I'm interested in yourself because you don't have a traditional MedTech background. You come from a finance background, right?
Law and finance, actually.
Yeah. What were you doing before AIRS then?
So I started my career at a law firm in Korea, and I was mostly dealing with corporate finance and M&A for about 4 years, and there, I had it was it was interesting and it was fun. I had a lot of useful learning experiences that I am using at
Yeah.
AIRS as well. But I wanted to have a bigger skin in the game, being an actual player in the game, rather than just being an advisor. While being an
Yes.
advisor was a necessary experience, I wanted to jump onto the real game. And then
Yeah.
I had an experience in finance in another a healthcare company that was acquired by a private equity for about 2 years, and
Sure.
that's where I kind of learned how the actual ecosystem of business functions from inside rather than kind of observing and from the position of an external advisor.
Yeah.
So that was also a useful experience for me to kind of learn how to operate a company based on the base product and the technology that the company has. And
Yeah.
there I kind of learned a lot in terms of based on how you depending on how you operate the given product and technology, that could just result in so much difference depending on the quality of the
Sure.
operation. And of course, it was the first time that I was actually running a company, so I made some mistakes, and there were some learning experiences, but those were very useful learning experiences, which I took advantage after jumping over to AIRS. And
Yeah.
uh, AIRS, it was kind of a no-brainer for me to join, seeing what an exciting adventure that the company was on. At the time I joined, we were just starting to expand to the global market. We have
Yep.
kind of tested the water in the Korean market for about 2 years, and then we had just started expanding into the U.S. market, and uh, it was a pretty surprising to know that lots of foreign medical AI companies try to break into the U.S. market, but it's a
Yeah.
very hard market to penetrate into, and we were lucky enough to have a product that has a very clear value proposition. MRI,
Yeah.
it's a very clinically essential modality, and but it's structurally rationed from what we've seen in the market. Uh, Even in the developed countries, the capacity of MRI runs at least a 10 to 40% below its clinical necessity, and
Yeah.
that's what AIRS Medical with Swift tomorrow was trying to fill in. And uh, as expected, we were seeing a pretty solid demand from the U.S. market, even when we were completely unknown to the market. There
Yeah.
were some early stage customers who were willing to test us out, and they tested us out, and we proved to be valuable to their operation, and we were able to first scale in the imaging center segment of the market for, well, let's say uh, the first year and a half. And
Mm-hmm.
uh, I think from a certain point, we started looking into the hospital segment of the market where the needs are somewhat more versatile, whereas like in the imaging centers are more primarily focused on the ROI. And when we're trying to get into like academic hospitals and a larger hospital system that we're trying to like get into now, they are also quite interested in getting aligning their operations from like a different sites and multiple sites that they run, and
Yeah,
also different radiologists have like a different appetite for the images that they want to read, and they want to increase the accuracy of the clinical data in MRI that they see. And it was like a very unlocking experience for us to
yeah,
be able to run into all those like a different demands from like a different segments of the customers. And
yeah,
uh, we ourselves had a chance to figure out what value that we can deliver to the customers with the different needs. And the beauty
yeah,
of SwiftMR was that the solution was designed to be versatile, being able to customize depending on the customer's like specific needs,
yeah,
and like that's how we were able to uh, unlock the hospital market, starting with some of the prominent academic hospitals, and now they're unlocking our like a door into like a larger hospital systems, and
yeah,
we are continuing to like add value to our existing solutions. And like it's all for like the mission of expanding the capacity of MRI, and be able to benefit the hospitals and the patients. And ultimately, like our goal is to be a standard of like MRI scanning. So I mean, like I envision like in the 5 years future, people, the radiologists are just going to be like using SwiftMR without even knowing
yeah,
that they are using SwiftMR, having like
yeah.
become kind of a standard in the market.
Yeah, becoming irreplaceable. I think, just touching on what you said at the beginning, you have a very, very clear ROI. I don't think there's many more, or if any, products in our space that has such a clear ROI, right? It's,
Mhm.
you get 50% more patients through the door, 50% more income, right? It's very, very obvious. But you're right. I guess not a lot of people knew who you were. So I find it interesting that, even now when I'm speaking to people, they don't necessarily know who you are, but
Yeah,
they know the
that's the
sort of
gap
solutions
built.
exist. They know
Mhm.
Swift MR.
Yeah,
And I think, like, for you guys, it was clear. It was all about education, right? It's just teaching what is possible. Because, a radiologist, a radiographer, a technologist, they're working every day. They're probably not as ingrained into the industry as we think they are. So,
hmm,
they don't necessarily know, 2, 3 years ago that this technology exists. So I guess you had to get your foot in the door somehow, right? And doing that through the imaging
right.
centers and the academics is definitely the way forward because, you said it yourself, breaking into the US is
Hmm.
so tough.
It is.
It's very, very tough. We see a lot of companies struggle. But, as we said, MRI is essential. And, it's the biggest, yeah, bottleneck, I think, in diagnostic imaging. From your perspective, what is the real problem that AIRS is mainly trying to solve?
Uh, yeah, so like as I said, unlocking the capacity of the MRI, it's gonna
Hmm.
mean a lot of like things like other than just filling in the existing needs. I think what we're trying to do like eventually is to introduce MRI into the space of like a preventive healthcare. So I think like
Yes.
MRI as like an intelligence uh, of like the health information is could deliver a lot of value, but like right now its capacity is just like so limited, and like it's so expensive. So like even though the hospitals and imaging centers wanted to expand their capacity, they're just like a block from like a physical constraints. And being able to shorten the scan time and you know, elongating the lifespan of an MRI machine, that's just gonna open up a lot of new opportunities. And it's
Yeah.
just realizing the potential that it always had. So uh,
Yeah.
there are some diagnosis that like only MRI is able to do, and if
Yeah.
we try to like channel that additional capacity and like a resource into the preventive healthcare space rather than like concentrating those resources on the patients like who are already like suffering from disease, I think like we can
Yeah.
make the world like a healthier place, and like that's the ultimate goal that like we're trying to reach, and like that's like our mission for the years ahead of us.
Yeah. Yeah. No, for sure. Um, you obviously spoke about the potential there. I guess at the moment, there is a lot of wasted, I guess, capacity. Do you think, the industry, whether that be the techs or, companies themselves underestimate how expensive wasted MRI capacity actually is?
Uh, yeah, I think like it really depends, and like there, as we like study the various like markets across the world, like there certainly are some like regions where like MRI capacity is not being like fully utilized. Well,
Mm.
some sovereign governments like subsidize their health systems better, so like they have a lot of like overflowing capacity, whereas in like in most of the regions, they're heavily like undercapacitated. And
Yeah.
what's interesting is that even in the regions like where they are like overcapacitated, because they are facing a heavy competition among the MRI operators, they still want to like deliver more value to their like patients by introducing Sutamar and like treat patients with like a lesser scan time and less painful experience of like scanning MRI. And uh, in even in those markets like we can still deliver value, and of course like in the regions where MRI is like a heavily undercapacitated, we do kind of like understand like why it's like undercapacitated like from the beginning, like it has its
Yeah.
own inefficiencies and like bureaucracies in trying to meet the needs of like patients in the market, and like for the same reason
Yeah.
that's functioning as a blockade for us to like get in. But uh, we are making progress in those markets as well, and once we
Yeah.
break in, like it's going to be a huge game changer and like be able to deliver so much value to the patients and like the health systems.
Yeah, for sure. And so Swift MR, of course, is your flagship product, right? In
Yeah.
simple terms, what does it actually do, like it on the system, and what is the result that it generates?
Uh, yeah, without like being too technical, like you can always like reduce the scan time by just like adjusting the scanning protocols. But like
Hmm.
the consequence that you get is like you get an image uh, filled with either like a filled with noises, like with low resolution, which is like unsatisfactory to the physicians who are reading it. But SwiftMR is able to essentially reconstruct those images like back to the standard of care or like above quality images, depending on the quality that the customer wants to see. So basically, like it reduces the scan time, meaning that like the MRI operators are able to, get 5 or 10 more scans per day, and like that's a huge
Mm.
difference when you span it out over a period of a year.
Yes, yeah, it definitely adds up. How do you, I guess, balance the clinical promise of AI with the operational, I guess, reality of hospitals?
Yeah. So I mean, like we always like try to listen to the customers, like that goes without
Hmm.
saying, and all customers they have own like clinical and operational needs. And
Yeah.
well, some customers like they are more capacitated like from operational standpoint, and like they uh, want to get as many scans as possible, and while some
Yeah.
customers like they're undermanned and maybe not be able to process as many images, like even with the technology, and like in those customers, like they try to focus more on enhancing the image quality that they see, and so them are also as like a clinically proven in our research papers, able to increase the clinical accuracy for some of the diseases that might go unnoticed under like a traditional
Yeah.
MRI scanning. So yeah, like we try to like meet the customer's needs depending on the situations that they face themselves with.
Yeah, I mean, it's so interesting speaking to, I've spoken to so many people about Swift, right? The number one pushback that I always got was, well, OEMs have their own sort of deep learning reconstruction
Mm.
solution, right? Whether it be GE or Philips or whatever it may be. I think the most genius thing I've seen you guys do is adapt the product so it sits on top of that solution. Because now someone will
Yeah,
say that to me, and I'll say, well, guess what? It actually sits on top of that as well. Um, and obviously, it's a competitive market, right? And like you said, it's a very obvious ROI. Why do you think customers are starting to pick AIRS over, OEMs and perhaps other companies in the space?
uh, like we are not trying to like position ourselves as like a competitor to the OEMs. Like they have the solutions that also like benefit their customers, and like we try to
Yeah,
deliver additional value on top of that. Uh,
yeah,
but like to answer your questions directly, like in both like a US and Europe, uh, health systems, they operate like a tens and like even like a hundreds of like MRs within their organization, and it rarely happens that like it's all from like the same OEM vendor. Like they
yeah,
have many radiologists like overseeing like a tens and hundreds of MRs, and they all have like a different appetites and different preferences, ending up with various models of like scanners from like a multiple OEM vendors. And when you're trying to kind of uh, deliver a certain value, like using a solution like ours within their like entire organization, they happen to like prefer a vendor who are able to like service all of the scanner types, and it
yeah,
may be like a less efficient from like operation standpoint in like a picking solution that are only able to service a portion of their scanners, meaning they have to like deal with multiple different vendors for delivering the same exact values to the scanners that they operate.
yeah. And so you mentioned value. Um, it's interesting because in the AI space, value means a lot of different things, and I think it's changed over the last few years. It started off a few years ago as, we're 10% more accurate, we're 10% faster, right? For you and your customers, where do they see value first, and where did they see value, I guess, after using it for a while?
Hmm. Yeah. So, I mean, like, as we positioned ourselves as an ROI solution, like from the beginning, we also like saw how the market was also trying to like introduce the diagnostic side medical AI solutions
Yeah,
into the market, and the challenges that those companies had, like they all have like great products and like they all deliver value from like a clinical and like diagnostic perspective, but in order to like penetrate into the health systems and imaging centers and hospitals, you gotta make sense for their like a purchasing department to like make a monetary investment into something that wasn't known to the market. And
yeah,
uh, like we were able to give a pretty solid financial case from the purchasing and the admin department, which obviously I can make the decisions on like a purchasing of the
yeah,
solutions. So we were able to initially like persuade them that like we will make money for them, and
yeah,
once you like step over the door, now like you get to like face the clinicians, the people who are actually like operating the MRIs, and they surprisingly are like a very hungry for the AI solutions that can make their lives like easier and better. And I think as once we set our foot into their doorsteps and build a great relationship with the radiologists and like the radio technicians by delivering them a solid value, I think like this will give us an even further opportunity to introduce other medical AI solutions that will also deliver value on the clinical accuracy and being able to predict uh, the diseases in the future, and just
Yep.
being able to get SwiftMR be introduced to those health systems, which are incredibly hard to break into just by delivering clinical value, is a huge win for us to
Yep.
do so many more great things in the future using technology.
Yeah. This is a little bit of a side question, but it's kind of related. I did a podcast before this with a good friend of mine. He is the CFO at Ferrum Healthcare. It's like a big platform, right? Name is Peter
Yeah.
Easton. He he comes from a finance and sort of legal type background as well. And because of the background that he has in finance, they were able to put together more of a well-rounded commercial pitch, I guess, to the real people who run the hospitals, which is the purchasing and finance departments, right? Like, because he understood that. And I wonder if perhaps if that's the same for you. I mean, it would be interesting to know if because of your background, you perhaps were able to portray the economics slightly better than perhaps someone who was a, professor at a hospital or a radiologist.
Yeah, I mean, we try to do a lot of a heavy lifting for the customers, like to be able to, persuade their internal decision makers, and we came up with more accurate models on how using SwiftMR could deliver, uh, you know, unexpectedly high economic value, even if they're not overfilled with the patients. So uh,
Yeah.
pretty common misconception that we faced while we were talking to the initial group of customers was that uh, they were questioning we don't actually have you know patients lined up for MRI scanning every single day, and we kind of model how even just addition of 2 or 3 patients a day is going to just deliver them a so much more return on the investment that they make on SwiftMR. And that's
Yeah.
kind of the base case. And if they are uh, having a great month, meaning flowing with patients even with the max capacity, it's just going to be a even more asymmetric return from the investment they make. So that was
Yeah.
kind of the pitch that we sharpened, and the pitch that I try to sharpen after I joined, and it was able to convince a lot of MRI operators and kind of mm, break the misconception of what it takes for a solution like ours to deliver them the financial value.
And so, I guess when a hospital is trying to, or an imaging center is evaluating as what is the business case that they're usually trying to prove?
Yeah, so for hospitals, they all operate outpatient imaging centers, and in outpatient centers, uh, the efficiency and operation is really the key to just to stay afloat. Hospitals are
Yeah.
always burdened by so much costs in everything, and
Yep.
it comes down to uh, unit efficiency of the imaging modalities that they operate, that kind of determines whether they stay in the red or green. And
Yeah.
we were able to establish some cases where by using SwiftMR, if they're able to add a 2 to 3 scanners a day, the current operation that is really fighting hard to break even is going to be comfortably over the line, meaning that
Yep.
they will be able to now reinvest that a surplus into other pain points that they were suffering from. So we kind of like try to show them the picture of like what additional things that they can do by like utilizing
Yeah.
SwiftMR. Yeah.
And so, imaging centers is obviously where you targeted first. Do you think it's easier to justify Swift MR in the imaging centers because throughput is, I guess, directly tied to revenue?
Yeah, of course. Like, and also the imaging centers, it's also a pretty competitive market, and they
Yeah.
try to kind of like a roll up and integrate amongst each other to have like more pricing power and like deliver a versatility of values to the patients. And as you said, throughput is the number one priority for them in terms of like their operation. It's really like the baseline. And
Yeah.
them being able to like market themselves with the innovator of the industry, like using the cutting edge technology and the AI, and be able to
Yeah.
reduce the pain that's like usually associated for the patients in taking an MRI scan, is also a pretty good
Yeah.
marketing point for them. And that's what intrigued some of our early customer groups to take a bet with SwiftMR, even like when we were not very well known. And
Yeah.
after that phase, ones who weren't like using SwiftMR were kind of like feeling pressure when like there
Yeah.
are like imaging centers in the same region operating with the cutting edge technology and be able to deliver more value to their patients. So I
Yeah.
think it's really like a trickling down. That's what we're seeing
Yeah.
in the market right now.
No, for sure. I think that's the type of benefit that's not directly tied. I mean, you've got patient scores and ratings, so on and so forth. But you can't put a monetary value to a patient's happiness, right?
Right.
It's difficult. You mentioned innovation and cutting edge technology. How does AIRS approach product development?
And try to assess like what pain points there are from the MRI operations and like in the related fields. And we try to like assess like what's missing in the market, and we try to leverage our existing technology and the product to build on that. So for instance, like a SwiftMR is also able to harmonize the images like taken from different modalities,
Yeah.
like a different vendor MRIs, and while quantification, like automatic quantification of MRI images is like a pretty critical from the clinical operations like perspective. The radiologists would spend their time for like a more high value clinical like activities if there was a solution that is able to do all the manual quantification for the radiologist. So that's also one of the things that we're trying to address. And the fundamental problem with that kind of solution is that like if because of the difference in the physics of the MRIs from like a different vendors, like a different models,
Yeah.
they are inherent with some discrepancies depending on like which vendor type that like the hospital operates with. And SwiftMR is able to significantly reduce the discrepancies among the images taken from different physics of MRIs, and that opens up like an opportunity to really like deliver accurate measurement of like the images, MRI images. And
Yeah.
so that's kind of the new product line SwiftSight, which leverages the critical value that SwiftMR delivers to the MRI images.
Interesting. Can we quickly pause? Sorry, my laptop is about to die. I don't know why it's not charging. Give me 1 second. Now we're cooking. Sorry. It was not plugged in properly. We're talking about, what? It's still not charging. We're talking about the latest advancements in AI tech, and I can't get my laptop to work. Why is it? Now it's charging. Okay, great. My apologies. If we can make a marker there, that'd be great. Okay. Yeah, I've spoken to quite a few people in the last few weeks who are in the neuro space. I won't mention companies in particular, but they're selling quantification solutions.
Mm-hmm.
And as soon as I mentioned that you're able to standardize the images across
Mm-hmm.
scanners,
Right.
like they really perk up. Their interest level, increases massively. And I think just being able to do that is like an absolute game changer, it seems. There's a lot of
Right.
people who are very, very interested in being able to do that. And if you can do that across, say you can do that for prostate or, for liver or wherever it may be, right? That preventative health space that you're trying to get into is just
Yeah.
such a massive market.
Yeah. So like the fact that like we're able to standardize the images is what we need to convince the market. It's a
Yep.
very you know groundbreaking concept if you think about it. And like I've been in the MRI space like long enough, and we are building like solid evidences in many like body parts and like under many like circumstances that we are able to indeed deliver standardization across the images like from different scanners. And it's going to take some time, but like I think like the market will eventually absorb the concept, and it's going to be like definitely a game changer in the space of MRI. And there are great solutions out there when coupled with imaging standardization is going to deliver a lot more value than like they currently can. So
Yeah.
we do see a lot of like partnership opportunities out in the market as well. I mean, like we don't
Yeah.
have to do everything ourselves. Like it's not the most efficient way of like running the business from the way I see it. So yeah, I mean, like we will be happy to have like a conversation who are interested in the value that we are able to deliver going forward as we expand our business.
Yeah, definitely. I think partnerships is the way the market's trending, right? I
Yeah.
was at Sim a few weeks ago, and there's multiple companies who don't even have sales teams. They literally just partner, and like the pack, they just partner with the PACS companies, and they sell their solution, right?
Hmm.
It's definitely an efficient way, although it's difficult when you're trying to grow globally. And I think you're at the point now where you're truly you're in 39, 40 countries, something like that.
Yeah, 45 right now.
Yeah, there you go. So you're truly a global company, right? How do you make sure the company stays aligned around sort of one mission as it expands across those markets? And how do you personally manage a global team?
Yeah, so that's a great question. And, I think alignment of the mission is the most important thing. The
Yeah,
value that we're trying to deliver to like the customers and the market is pretty clear, and like everyone is very well aligned in that. And the caveat is that the way that we deliver the value could be regionalized depending on like what market you're addressing, and trying to standardize like all the pathways into delivering the value and like, achieving the common goal may be a mistake. Is like
yeah,
something that like we've learned while we're operating in many different countries. And each market has its own like distinct features, and like that's what we need to like adapt to understand and like get into those markets. So what we learn is being able to trust the people who are working in that like a regional market, and like trying to do the right thing, and being able to trust them and delegate to them is like the key to
yeah,
expansion into like many different countries. And yeah, like while we try to regularly sync on the ultimate value and the goal that we're trying to achieve, we try to give a lot of like a discretion to the people who are actually like running on their foots and trying to
yeah.
meet the customer needs and like expanding our footprints in the regional markets.
Yeah. Well, you answered my next question, which was going to be what changes when you move from, from being a strong product company to a global organization. I think it's just taking that trust in your employees and being able to delegate. And I know delegation's not easy when it's, the company's something you're passionate about and you're growing and it's your reputation. But yeah, I think, you're hiring people for a reason. I think utilizing their knowledge and their skill sets is important. From your experience, how has, the US, Europe, and I guess Asia, which are the main markets, how do they differ for MRI and AI and just in radiology in general?
Yeah. So, first of all, like the price of each MRI scan is like a vastly different, like
Yeah,
across the region. In the US, like it's the most expensive, and like in Asia and like Europe, they're sometimes like surprisingly low. Even in like the
yeah,
developed countries in Europe, the government like subsidizes a lot of like MRI scanning.
yeah,
And what we found interesting about the European market was that like since there is a pretty strict government control on the price of the MRI scan, there are like lots of hospitals and radiology centers that are really trying to just like survive by
yeah,
accelerating the MRI scanning. And there we kind of like realized that like the ones who are trying to stay afloat by enhancing their efficiencies are making much more, uh, I'd say like a fast and innovative decisions in like adopting new solutions. And like
yeah,
the same thing for Latin America. It's incredibly difficult in like the countries that have depreciating currency values to
yeah,
purchase like a new MRI scanners. And when you're operating with majority of older MRI scanners, using a solution like SwiftMR kind of becomes essential for
yeah,
the survival of our operation. And like when you become a must-have in their operation, then like a good to have, which takes a lot of persuasion with the customers. Like you get a much faster penetration into the market. And Brazil like has been a very surprisingly good business case for us. And
yeah,
we are now into like over 300 MR scanners in Brazil. And like
um,
we like weren't expecting much from the South American market, as like it's the farthest continent from our HQ in Korea. So
yeah,
as we like expanded into different markets, like what we kind of learned is that uh, you can't like know everything. Like even if you try to like study the market beforehand, and you need to
yeah,
like face the realities and always adapt to the situations. And
yeah,
yeah, kind of like I was kind of sidetracked, but to elaborate more on like the difference of MRI scanning practices across different regions, uh, Korea is also like a very interesting market in from the perspective that in most of our regions there are at least like a 15 to 20% market share for the low magnetic field MRI scanners, like
yeah,
zero point 0.5 Tesla, zero point 0.3 Tesla, because like they're like a cheaper and like a more
hmm,
efficient from like economic standpoint. But you you see, I like we've never encountered into like any of the low field scanners in the Korean market. They all use like at least 1.5 Tesla market.
mm,
And we kind of like live in a culture where like everyone uh, you know place a great value on the peer pressure. And
sure,
if you're using an low field low magnetic field scanner, you might be like a mistaken for practice that cares less about like the quality of the treatment that they deliver to the patients,
mm,
like the ones who are only caring about like their economic interests. And
yeah,
that's, I think, like an unfortunate misconception, which kind of like hinders the development of market to its like a specific needs. But like it is what it is. Like, and if we're able to somehow shift the landscape of the market where they can become more efficient by uh, letting the patient understand that like even the low Tesla scanners could be like as good as like the high field scanners
yeah,
if they're equipped with SITMR. And
Yeah.
like a lot of low field MRI vendors are collaborating with us to deliver more value to the customers, and that's our niche market as well. Yeah.
Yeah.
So
I think for that, I know you didn't bring it up, but the low field MRI, you said obviously economically it's better for the hospitals, right? And surprisingly, they're very, very good solutions, especially when you combine it with Swift MR. I don't know if you're there yet, but places like Africa, right, like underdeveloped, sort of
yeah,
nations, I think, where they need low field MRI because they can't buy a brand new Philips 3T Tesla, right? But a point 0.3 Tesla low field MRI combined with Swift MR, I think in these developing nations you're going to see massive
right.
growth once you get there, right? What, I guess, challenges have you found about scaling internationally, and what have you found hardest?
Yeah, so like it's really building our presence in the market. I think like
Yeah,
that's the key to like a win the trust of like the medical professionals. I mean, they have all the reason to be like a cautious of unknown vendors disrupting their like
yeah,
operations and posing a lot of like a clinical risk on their operation, and
yeah,
it's totally understandable. Uh, so really like building our presence in the market is like a very grinding job from like
yeah,
what we've seen. We try to form many like partnerships with the established players. We try to attend as many like conferences as possible to make ourselves like a better known, and we try to take good user experience from our existing customer base and like let the customers speak for themselves. And
yeah,
those kind of like words in the mouth naturally like flowing in the market, I guess the always the best way to build trust in the market. And
yeah,
once we build trust, I think like we will have like a much greater potential from commercial standpoint, and like that's what we're observing in Korea. So we've operated the longest years in Korea. Obviously, we've been
yeah.
in Korean market for about 5.5 years, and now we're into 27.5% of all the MRIs installed in Korea,
Wow,
and like that's pretty like remarkable feat from the way we see it in
huge.
like less than 6 years. And I think like that's where we could be globally in the next like 4 or 5 years, like if we uh, execute on the right path. And there will
Yeah,
be challenges, different challenges that we face in like other different markets, but like that's what we're trying to always overcome by trusting and like delegating to the right people
yeah,
who are all trying to do the right things. So
yeah,
yeah, we're hopeful that that's going to be like where we are going to be in like by like 2030, I'd say.
yeah. I mean, it's a snowball effect, right? The reality is we're in an industry that's still very immature, as in AI technology, especially in radiology, it's still very, very new, right? Even like PAC systems have only been around for 20, 25 years, right? Like,
Yeah.
I think it's important to realize that we shouldn't get ahead of ourselves, and word of mouth and trust, as you said, is the most important aspect, because there's still so many people who don't know about these solutions. Then they hear about them, then it takes them a little while to trust them, then it takes them a little while to try it, then it takes them a little while to buy it. But continually,
Mhm.
you know people will think, oh, 3, 4 years, 2030, that's quite a while away, but in the greater scheme of things,
Mhm.
it's not that long.
Yeah. Right.
um as obviously you stepped into this new position that you're in. What's changed for you as you moved into this role?
Uh, yeah. I mean, like changes it changes the world
Yeah,
from the way I see it now. Now, like I happen to have to take the ultimate responsibility for like what goes on in the company, and I think like it's a very meaningful transition
Yeah.
in being able to like shift the way I have been seeing things and like the way I see things now. And
Yeah.
like when I was only like operating from the financial perspective, like that was what I was focused on, and like now I
Yeah.
have to be responsible for like all aspects of the operation, and
Hmm.
I understand. I happen to like understand better on like what caused like the frictions from in the global expansion like a standpoint,
Hmm.
and uh, I always thought that like the standardizing the process from the headquarters perspective would be the right way operation, and
Yeah.
like as I now start to like see all the aspects of like what's going on globally, uh, it just like had to be like humbled in the aspect that you can't like predict for everything that's going to happen, and like you cannot
Yeah.
engineer and like a plan for all the upside that like we could potentially capture in the market. And
Yeah.
it takes modesty to admit to yourself that like you're not no one can be like smart enough to be able to like know everything and be omniscient and try to
Yeah.
control everything. And even though like I may be sometimes like uncomfortable letting other people like make the decisions uh, for the decisions that I may feel more comfortable like in making myself, but I can't
Yeah.
do that, and like it's not the most optimal way of like running a company, especially
Hmm.
for the one that's trying to like, grow at a very fast pace. So
Yeah.
yeah, kind of shifting the psychology is like the biggest transition that I'm kind of
Hmm.
making internally.
No, for sure. Obviously, you move from just managing finance. How do you decide where to focus when the company has product, commercial, regulatory, people issues, and I guess global expansion priorities? All at the same time.
Yeah, so like think the first thing that I focused the most was like a people and the structure of the organization and like the governance structure. So it you really have to set the right rule of engagement between like a different department and like a different functions and different entities for them to realize their maximum potential. And
Yep.
uh, you need like the right people with the right kinds of like personalities and the skill sets in the right place. And so that was what I tried to like focus on in the first few months of after like becoming the CEO. And
Hmm.
after that, like we're still in the process of kind of setting the rules of engagement between different people, and we're seeing some like trials and errors and what couldn't work and like what could be better. And
Hmm.
once that becomes more like a stabilized, I think things will kind of run itself without like a much intervention. And
Yep.
yeah, like after that, like it's the shift, the focus is gonna be on expanding our product for portfolio and
Yep.
expanding like those new opportunities with the additional products that like we're gonna be like launching in the market. And
Yep.
this year is going to be an inflection point in the U.S. market from the way we see it, where I think we'll finally break into the larger health systems in the U.S. And like that's just going to be the trigger for the rest of the market to kind of get buy in the legitimacy of our products in this space. And
Yep.
uh, as we open the doors into the large health systems, I think like we're going to be a lot closer to being the standard of MRI scanning than ever before. So yeah, we have a lot to look forward for the remainder of the year, and like a lot of things to work on as well.
I don't know for sure. It's. My question was going to be about becoming the standard, standard method of care, and obviously you're doing that in Korea, right, in such a short time. What over one quarter of the market. That's it's crazy, right?
Yeah.
Considering how short of a time you've been there. So we can look forward to 5 years, but I think, I imagine you as CEO, you probably break things down into, years and then into months, into quarters, right? What are you most, I guess, excited about for the next 12 months? Where do you see AIRS being in 12 months' time?
Yeah, so I think I kind of like answered the question that like you were going to ask, but like in the U.S. market, breaking into the health system and like establishing ourselves as a more legitimate player is going to be the most exciting thing, and we're adding a lot of like a new high talents to like help us like do that, and
Yep.
uh, as we like have recently closed the investment round from TA Associate, which is a very renowned international
Yep.
private equity firm, and they have like so much experience and like a network that they can offer to us in benefit
Yep.
of our fast expansion. And what we look forward to is that like we can really like pick their brains in terms of like uh, seeing a lot of companies grow from sub $100 million ARR to like over $100 million ARR operation. They must have seen a lot of patterns of the
Yep.
pain points and hurdles that like companies have to overcome to like
Yep.
reach a certain milestone. And
Yep.
I think like using those intelligence, we can make our process like a more efficient and go through less errors in terms of
Yep.
like making a lot of like new trials, and like that's all going to be a very meaningful learning experiences for the entire organization.
Yeah, I think a saying that I have is it, with experience, it's not knowing what to do, it's knowing what not to do.
Right.
Because they could bring you all this money and all of this investment, and you know we've seen plenty of companies blow it, right, and waste it. But they've been there and they've done it. They've worn the t-shirt. They know what mistakes to avoid, and I think that's the ultimate sort of benefit with experience. Is it saves time and it enables you to make the right decision. My last question for you is, what should customers expect from AIRS next?
Yeah, so we have launched Swift Site volumetry at the beginning of the year, and we just got the FDA approval for more Swift Site product lines. So like we're launching Swift Site MS and Swift Site DTI sooner or later, like in a couple of months, and like then Swift Site area will follow, and we will have a few more solutions touching on like the body composition and like potentially knee and spine as well. So there, I think like the need of quantifying the images and like getting a better intelligence from the MRI images like is pretty prevalent out there, and
Yep.
we are able to deliver the value that like the customers want, because like we are able to like standardize the images, and there we are doing like what we can for the time being, and there will be a lot more things like we will be able to like replicate for like
Yep.
many different body parts, and like different customers have like a more different like priorities in terms of like what body parts that they take the most and like prioritize the most. So
Yep.
yeah, like we're trying to meet many of our customer needs and make their operations and like clinical experiences a lot more efficient.
Well, look, it's clear that everything you do is around the customer experience, right? And I think if you have that at the center of your operations, your strategy, your sales strategy, product development strategy, I think you're halfway there to building a good company, right?
Yeah.
I've worked with a lot of companies and I've worked with a lot of people within AIRS, and you're all working towards the same mission. Everyone's very humble, everyone's very very driven, and I think it's clear that that starts right at the top, right, with you. So I think you're solving a lot of real challenges, and you're doing it in the right way. So I appreciate you taking your time. I know it's what 11 p.m. for you, so hopefully we can get a beer when you move to Dallas, and yeah, we don't have to be what 13 hours apart. Um,
Yeah,
Yeah,
I
it
mean,
was.
like it was a lot of fun talking to you as well, and
Yeah,
this kind of moment really also helps me kind of gather my thoughts and like, look clearly into what I should be doing next. So yeah,
yeah.
thanks for this opportunity as well.
Of course, I appreciate it. Cheers.